Hey y'all, so tonight is the COVID booster and vaccine session for Haya. We're gonna have some health professionals on tonight, and Sid will be on shortly as well. But we're just gonna wait for our guests to join, and then we're gonna get started with the session. Hey Donovan. Hi Dr. Tran. Hey, and there goes Sydney. Sydney's camera will be off for the first half of the session, and then she'll be on camera with us on the second half. And I believe we're waiting for one more guest, but while we wait, I guess we can do a check in because I know today's the last day of spring break, and my dance teacher she just texted me and told me that I have to bring my clothes tomorrow for dance class, and then we're gonna be in the studio. So I'm not that much excited about that because I went to two dance classes over spring break and I'm still sore. So I don't know how I'm gonna do her dance class either. So I'm excited, but I'm also still in pain from the other two dance classes I went to. So definitely put in a chat what y'all did for y'all spring break. I know I did that, and I did a lot of painting as well. And Dr. Train, if you could tell us what you did on your spring break as well, because I know you have kids too.
We didn't do very much. We stayed home a lot, but I did try to take them to the carnival. There was like a little carnival in Montgomery County at the mall. So it was my 4-year-old's first time on all the little rides. So I was like so proud of her because she went on the really high one that spins up and down. So it was great. She is nothing like me. I'm all afraid of heights.
No, I
Hey
love
everyone.
I love the carnival. Oh, go is it?
What's up, y'all? What's up, Gemma? Hey, Dr. Tran. Like Gemma said, my camera will be on hopefully the second half of this session. But my spring break has been really good to me. I've really been getting a lot of rest in. I've been binge watching a lot of shows because when like the school year is in session, I don't have a lot of time to like do anything like that. I'm strictly work and school. And yeah, so I've been catching up with some shows like you did. I went to the carnival like this Saturday that just passed, this Friday that just passed, and it was really cool. It was not the best one, like the one out Timonium. I went to the one near White Marsh, like out Hanover, I mean Middle River or something like that. So it was pretty cool, but I'm ready to finish up the school year. You know, once we get back in here, it's like about to get wrapped up really quickly. I know we got SAT testing like the 26th of April, like next week, soon as we go back. So like just getting ready for everything.
Yes. Donovan said that he relaxed and he hung out with some friends and it was just amazing. I know a lot of people was like going on like little friend dates and stuff and I was just like I don't know, I didn't really do nothing. I spent time with my boyfriend and that was pretty much it. But I didn't like go out with none of my friends, which I really wanted to do. We supposed to like take a day trip to Ocean City, but that was a whole that's a whole nother story. Um, Bless said she didn't do much either, and that she had a picnic on Saturday. I need to go and have a picnic one of these days because it's been nice, but the weather be playing games. It'll be nice, but it'll be like really windy, and it's like you can't do nothing outside because it's like super windy. So I be like, okay, it's not really that nice of a day. It's just like fake being nice.
It's
Um,
cold today too. Like,
Yes, it was freezing. And I'm like, we're supposed to
I
warm
need a
up later in the
sweater.
week. I'm like, no, I need consistency. I need 80s for like 3 weeks straight. What am I gonna do with 3 days with 80-degree weather? Like that's nothing. And then it just pop up out of nowhere. So can't even plan anything. So yes, it's bipolar. It's just all over the place and everywhere. And I'm so very sick of it. I don't know why spring can't just like come in full blast and stop playing around. No, for real, none of it fake being nice. But if you're ready, Dr. Tran, I don't know if Dr. Sylvia if she no longer can get on or not. I didn't receive an email saying that she couldn't. But
She's trying to come on. So, but we can definitely get started in the meantime.
yes, definitely. So we can go on to the first question. And the first question is, so y'all know last session we talked about like the booster. Dr. Tran gave us all like the good information about COVID. She gave us like her little like comparisons of like what it is and all that. So that was real fun. If y'all was here the last session, it was really good. Hey Naeem, hey Tana. So the last session we talked about the booster, and we're still gonna talk about the booster this session, but just like some different questions about Like what's been happening now, y'all know the mask restrictions have lifted. A lot's been going on like with schools and just like a lot. Like everybody, like I know like me, it feels like not like COVID is over, but like I feel like it's slowly going away, but then like it popped back up. So I'm just like I'm very confused and hesitant at times. But before we start off again, if we could just start with you all sharing like what is the booster and how or why it is beneficial to get it.
Yeah, absolutely. So, hi everyone. It's good to be back. So, for those who I haven't had a chance to meet online, so I am a faculty member. I'm an associate professor at the University of Maryland School of Pharmacy. And then I also see patients. I know that it's kind of strange for a pharmacist because that's my trade. I'm a pharmacist. I actually see patients in a family medicine office. So I work with a lot of different physicians and I help with their medications for those physicians and those patients. So that's kind of my background. I do a lot with COVID vaccines, and that's kind of why I was kind of asked to come here and talk with you guys. So what I think kind of the question Juma was asking was kind of what is a booster really? Just kind of giving a summary. So it kind of sounds exactly like its name, right? So you want to boost your immunity. It's an extra dose of the vaccine after you get your original or what they call primary doses that after it's been administered. So for the Pfizer and the Moderna vaccine, it was 2 doses for the original or primary series. And if you're immunocompromised, which is a term that we use for those who don't have a great immune system, so those like, let's say with HIV or cancer or those who are pregnant, they actually start with 3 doses, not 2. Or if you had gotten the J&J or the Johnson & Johnson vaccine, you would start with 1 dose as your primary series. And then if you're immunocompromised, you would get 2 doses. So after those original series, then you would get booster doses to help remind the body about your body's immune system, that how the virus looks like, so that way you're prepared to defend yourself against the virus when you get in contact with it. So the last time I was here, I kind of used the term about playing a board game. Okay, so like you learn how to play a board game, and you remember all the pieces and how to play and what the rules are, and that's what it's like when you get your original doses or the series of your vaccine. But over time, if you forget, right, you don't play the board game for a while, you kind of forget some of the rules or you forget what some of the pieces are like. That's why you need to get a booster dose to kind of keep reminding your body what it's like, what the virus looks like. So that way, right when you start the game, you're ready to go. So that's kind of the analogy that I had used last time I was here. So I think it's especially important to get your boosters. One of the things that I'm sure Juma will probably ask us is in relation to the variants, right? So we had Omicron a little while back during the holidays, and that had a lot of things. So, the booster really helped. There's a lot of good studies that show that the booster really helped during Omicron. And now we've been getting what they call sub-variants. So they look kind of similar to Omicron, and those are starting to creep back up. That's been in the news more and more recently. So it's even more important to make sure you get your boosters.
Yes. Hi, Dr. Silva. Thanks for joining us. Dr. Tran was just going over like what a booster is, how it's beneficial, and like all of that stuff with her analogies. So if you could just give a quick introduction, and then Sydney will ask y'all our next question.
Perfect. Hi, I'm Dr. Silva, or Julia. I'm one of the family medicine physicians at University of Maryland Family Medicine. I work along with Deanna Tran, and I'm excited to talk to you guys about COVID and COVID vaccinations today. Sorry I was late. I was just finishing up work before I could come on.
Hello, Dr. Silva. My name is Sydney. It is so nice to meet you. Me and Gemma was definitely looking forward to seeing you today. And like Gemma mentioned when she was explaining the first question, like it kind of feel like COVID is over now, or like, things are lifting and like stuff is becoming more open. And it's very exciting, but also like nerve-wracking knowing that we've been like pump faked so many times thinking that the COVID was almost over, but then like it gets worse or a new variant comes out and stuff like that. So my next question for the both of you is like, what is the change within your work life has been like for you now with the mask restrictions lifting and like, people being able to return back to their offices and stuff? Like, how has that impacted like you overall?
Yeah. It's a really great question. For myself and maybe
Is she skipping
patients
out?
are sick. And so for us, my connection does seem like it's going in and out, but so just to reiterate that at work for us, we still wear masks with patients because we're just at higher risk of getting COVID because people can come in with coughs or colds or fevers all the time, and we're not sure if it's COVID or not. So we universally wear masks for every patient. And so at work, it hasn't changed. But a lot of you don't work in healthcare, so in personal life, I'm on the little bit more hesitant side to take off masks because we get to see sick people every day, and some of the COVID numbers are actually starting to rise again. So we're seeing some increased COVID numbers in the community, and I kind of think of it like this: like if I am hanging out with friends or family in a place that I know that they would tell me and be honest if they were sick, I'm not going to wear a mask. But if I'm in the grocery store, I don't want to get COVID from someone in the grocery store. People cough, you don't know who's there. If I'm like out about like in the community, like I don't know what other people are doing. I don't know that they're, not out there coughing away or have a fever. And so I usually still wear masks where there's a lot of people that I don't know and that I can't trust to not just be out in the community with COVID.
I totally agree with everything that Dr. Silva said. It's not really any different in terms of when we are in clinic, because we still have to wear our mask and our eye protection and our scrubs. But I do want to say from like my kids' perspective, because in daycare, they are required to wear their mask, like 2 years old and up. And then they lifted that restriction so that the kids didn't have to wear the mask. They could if they wanted to. And like for weeks on end, we have had continuous colds. And then there was like a little outbreak of flu in one of my daughter's classroom. And you know what? It kind of reminded me was, if I had ever doubted masks, this is the time to remind me that, it has helped so much to think that I went a whole, winter season with no colds until now, because they took off their mask. It's a good reminder that masks really do help.
Yeah. And I think that's true. Like a lot of the patients that we see in clinic, not all of them are coming in with COVID anymore, but many of them are coming in with the regular like flus, colds that we see the rest of the time that had significantly decreased in the last 2 years when people were wearing masks because people weren't, coughing all over everything. And so we are seeing some more flu, people coming in with flu that we didn't see much of in the last 2 years, people coming in with what's called RSV for little kids. It's a really common cold that they get. Those have increased, and we hadn't really seen a high amount of those in the last 2 years.
So I'm gonna go on and ask our second question, which is just about like kind of going way back to the beginning of the pandemic. And it's okay if you don't remember some stuff, because I know when some people ask like, what were you doing like right before the pandemic started? I feel like, well, I don't even know what year that was. So like I be having to like backtrack and like remember like what grade I was in and all of that stuff and like remember what I was doing. But COVID was very like sudden, and then it's just like, bow, it's here. And then we was just like in the house for this very long time. So could you just share a little bit like how it affected your job as healthcare professionals? Like how was it different, like seeing patients? Was it virtual? How long did it take to get the virtual? Just kind of like your experience with that, or if you know people who are like actively working like within hospitals and like the stress levels they experience and different things like that. So just how it impacted the healthcare world.
Yeah. That's a really great question. So I got the lovely opportunity to be in Seattle when this whole COVID started. So I came back from a vacation, thought I was coming back to a normal world at work. And then we had that first outbreak in Seattle, and it was sort of the focus of the COVID pandemic in that first few weeks. So before the rest of the country was doing, all of a sudden we were wearing masks. They were telling people to stay home, restaurants shut down. I was working in the hospital at the time, so I was like, oh, I guess I can't get any groceries anymore because the grocery stores were empty. But I think for healthcare workers, a lot of it was unknown, and that was the kind of scary part, that we weren't really sure what was going on, and we didn't have enough testing for people, and that was a really big problem. Now it's super easy to get a rapid test. It's pretty easy to get a PCR and then come back pretty quickly. In the beginning, I would have to say like, okay, like I really think this person has COVID, so we should test them. because I only have like 5 people I can test a day because we only have 5 tests in our clinic. And so there was a lot of kind of juggling of like, who do you think really has COVID and who we should test, or we should just say, like, you should probably just stay home anyways. And I think that unknown was just really scary. And then through the whole pandemic, it's been a lot more work on healthcare providers, learning how to navigate kind of new COVID recommendations that are coming out, the surges with increased people in the hospital, and a lot of different stresses that we didn't experience before. So I think that's why you're seeing from a lot of healthcare workers, some of them feeling a lot more stressed, or maybe leaving their jobs or changing jobs because of that increased stress with the pandemic.
And then for me, as a pharmacist, I don't normally wear scrubs or, all this other stuff. So that was like a big change for me personally, when, we were asked to wear scrubs and, all this other protective gear. And it really helped remind me that I really am working in healthcare, because I also do, as another part of my job is a lot of teaching. And that changed so dramatically because we went to spring break and then just never came back. And was trying to figure out how to teach virtually to pharmacy students and teach them skills that normally they have to be in person for, like how do you do vaccines? I was trying to teach vaccines online. It was so crazy. And it was the same thing with, working with patients, is trying to help them set up technology so that we could also talk to them virtually. So we learned a lot. I think that, it helped us learn to be a little bit more adaptable and flexible, and change with the times, because things are moving so quickly and information is coming in so quickly. I think that's a big piece, is that we're all trying to adapt to the increased flow of information, just like you guys. You guys are bombarded with all the information out there, and so are we. And we had to sift through them and figure out what's important to help our patients as well.
Yeah, I definitely agree. This has definitely been like a huge change for everyone. And even in like the schools, like, when we first came back to school, they had like the big barriers between us, and we had like assigned seats and stuff. I'm like, this is kind of like we're in pre-K again. Like we can't sit next to our friends. So it was just definitely a lot of changes from COVID, just going back into like work and school. So with my next question, how has the media made things harder for you? I know, like, especially during the beginning of the pandemic, everyone came up with their own narrative and story about how the vaccine works, what COVID is, and everything. Like, how is it for you as medical professionals to like destroy those single stories and like actually promote the truth? Like, has the media helped with giving correct information about the booster, or has it more so like made it harder for you?
I think it's a little bit of both. I think what I do appreciate is that it helps to bring information to everyone. Now, before no one really knew all that much about how vaccines were made, and now more and more people do. So sometimes that helps. That additional information about science and how it works and how it goes into our healthcare system helps to empower people to feel like they're part of their own decision-making process, which I think is a good thing. The hard part is, now, especially with social media, everyone is just posting things, and they may not have the appropriate information, and some people might just take it for what it is, right? I'm like on TikTok not that often, but I do kind of obsessed by when I scroll through things. But like some of those stuff is like, that you could do this, and then when you try to do it yourself, you're like, that didn't work at all, right? Like some of those hacks and stuff. So I think it's important to think, try to look up information. I think that's important to find out whether or not it's true or not.
Yeah, I'd agree. I think in some ways it could be really helpful. Like, I think about like how many of my patients even knew what the CDC was, or Centers for Disease Control was, at the start of the pandemic. And probably everyone is at least somewhat familiar with that now. And so media from, news or Instagram or TikTok that kind of promoted some of the vaccines, or promoted, that you should wear a mask, stay like socially distanced for people, that was helpful. But as someone mentioned in the chat, the saying that it makes you magnetic, those things have been really unhelpful. So, we get questions from patients. They're like, I heard on this show that the COVID vaccine makes you magnetic, or I saw one recently that it was like, I heard that someone got a COVID swab and it like pierced through their brain. And like those things are things that while some of them are kind of comical, it also makes it harder as healthcare professionals to kind of sort through that with our patients. Because a lot of times, we're trying to give kind of the best information, but when people are reading all of these other things, we don't only have to give the best information, we have to sort of talk about like maybe some of that information that's not true, that's coming through TikTok, and some of the stuff that's just this is plain wrong, like the magnetism. I think when that person, I think she ended up like trying to do it again and the spoon dropped off of her. So I think it's sometimes hard to combat some of those things when it's so prevalent that they have all of this kind of false information about the COVID vaccine and getting the COVID virus itself.
I think too also is that because things change so quickly based upon research that's coming out just as quickly as it's hard to keep up, right? So when the media, like for instance, I remember a big thing was like when Omicron started, they were like, oh, Omicron is so super mild. And like everyone in the media was talking about it. So then that became like the thing. Everyone was like, oh, it's mild. Like there's nothing wrong with it. But then it still overwhelmed our healthcare system. And it was hard to come back from that because even though the media was trying to explain it, it was already out there and everyone was already talking about it, thinking it was only mild. So that's also the hard part about, everything being talked about in the media because it's like the biggest news of all.
Yeah, so for our next question, like I said before, about like the restrictions lifting, and I know like Baltimore City Public Schools is like one of the last like school districts to lift the mask restrictions, and I know like right before we went on spring break, well, the last day I had, my last day was Thursday. I left after my ring ceremony, but the last day was Friday. I know my teacher was saying, he was like, if you're not wearing your mask, I recommend that you start wearing it again because we had like a small spike in numbers. But they just told us that like the numbers went down like a lot and it wasn't as many like critical cases of COVID within the hospital anymore. So is this like all an exaggeration of the numbers? Are they dropping? Are they not dropping? Like, was it really a big difference in the numbers of cases that it was like necessary for the mask restrictions to be lifted? Or was they kind of just like, all right, let's try it by lifting the mask restrictions, even though the numbers haven't changed that much? And they just lifted it just to see like how it would go, if there would be more cases or if the numbers would like stay at a steady rate or anything like that. So was it any exaggeration within the numbers and like pertaining to the mask restrictions, and as well as do you still see like serious effects of COVID like within your line of work, so even within patients or just like within the medical field in general with the people that you all work with?
Yeah, so I think the thing with the COVID numbers going, up and down is it's always a moving target. So I think we're going to continue to see that, probably COVID numbers going up and down, and it's a little bit delayed as well. So like right when everyone takes off masks, it's not like we're going to see a huge spike in that. Like it may take a week or two to start seeing those numbers go up. And so that's what we've seen this number slightly rise as more people are taking off masks. And, it hasn't become to a level that they're recommending a masks for everyone again. But for at least me personally, it's risen to a level where I'm less comfortable going out without a mask than I may have been 1 or 2 weeks ago when they had just lifted the mask restriction, because those numbers are going up. And so I don't think there's necessarily an exaggeration of the numbers, but I think it's a moving target because, we're going to see if everyone is wearing masks and people are more vaccinated, we're going to see those numbers go down. However, there is some expected bump when the numbers go up because, like I said, people are out in the community kind of doing whatever, and may not be as, ready to like wear a mask if they're feeling sick, or like not go out if they're feeling sick. And I think we all have sort of that cabin fever from the last 2 years of really like wanting to go out, wanting to have these big celebrations because we haven't been able to. But unfortunately, because we know COVID isn't completely gone away, it always comes with the risks of potentially, having someone there who does have the virus and potentially spreading it.
I think the only thing I would add to that is, I totally can see how frustrating it is with ups and downs. And it's like, now take them off, now put them back on, But I think part of it is because, when they are low, when the rates are low, if we don't recommend potentially taking them off, then you get even more frustrated, right? It's like, even in low periods, you don't take them off. And high periods, of course, you have to wear them. So I think that, it was a balance that was struck about, if you're really low numbers, the risk of getting COVID is a lot lower. So, why not try to go out and, be able to see people and talk to people and hang out with them. So I think that was part of it. I will also say, if you want, or if you're interested in looking at numbers, especially let's say like for Baltimore City, you can go into coronavirus.baltimorecity.gov, and it actually shows you all the numbers for Baltimore City specifically, since that's what we're at. So you can really see what the numbers look like in terms of the ups and downs, and if you're really interested. So that way you can judge for yourself in terms of whether you feel like it's an exaggeration.
And I think the second part to your question was, are we still seeing serious effects places? I barely work in like the intensive care unit, and I only occasionally work in the hospital. But, they are still seeing people who get COVID and have pretty serious outcomes. It's still going to be your patients or your people who are older, who have a less good immune system, like heart disease, lung disease. Those are the people who have been more ending up in like the hospital or the intensive care unit. But I still see people all the time that it puts them out of work for several days because they still feel pretty crappy. And then the other part of that is we're still not sure about sort of the long-term effects of COVID. Probably heard in the media the kind of long COVID where people have these symptoms for, several weeks to months after they got a COVID infection. And it's still a little bit uncertain kind of where we're going to see that go, whether, people are going to continue to have sort of those symptoms months after they have COVID, or potentially years now that we've been in this pandemic for 2 years.
I did see a really great graph just yesterday that was saying from the World Health Organization, which looks at the whole entire world. And we're at the lowest death rates for COVID as of yesterday. So, trying to keep our hopes up.
That is positive. That's awesome.
Yeah, that's definitely big, especially because I hear different things every day. Like one day is, oh, like such and such people died from the COVID today, or yesterday was low, but today is higher than it ever was. So it's like it's just a whole bunch of up and down, like every day with COVID. The follow-up question that I have was, what things are changing with COVID? Like, are health professionals still recommending the vaccines and booster shots? Why or why not? I know that I'm not really hearing like a lot about the vaccine as much as I was when it first came out. I don't know if it's because like COVID is going down, or like more people are vaccinated enough to stop the spread, like the spreading of COVID faster. Like, what is that like now?
I can start. So there's actually been more recommendation and changes to how the booster doses are. So you might have heard that there was initial booster, but there's actually been probably in the last 3 weeks or so was when we had a recommendation for a second booster for certain populations. So those would be our older folks, so anyone 50 years old and older who got their last booster, so their first booster 4 months ago or more, they can get a second booster. And those who got just the Johnson & Johnson for their last 2 doses, because they're showing in the data that the Johnson & Johnson vaccine is not as effective as the mRNA vaccine. So they're now recommending that those who only have gotten Johnson & Johnson to get a booster dose with an mRNA vaccine. So those are some of the discussions. There's also some discussions about, I don't know if you've heard, but they're trying to work on a vaccine for children from 5 to 11 years old. So that will probably come out in the near future as well. But currently right now, for children 5 to 11, they don't recommend any boosters. But in the background, they've been putting in applications to the CDC and FDA to kind of get that approval. So that might come in the next few months.
And I think that overall, the recommendation is to still get your COVID initial vaccine series. If you haven't done that, to get your booster vaccine if you have done that. I think, now that we've had the vaccine for a little over a year, most people have probably heard about the vaccine at least once, if not over and over again. And so, we're not seeing the amount of media kind of coverage about the vaccine or not, unless there are changes in the recommendation. But I do still think that it's really important to get the vaccine because it can protect you from getting COVID, as we still see that people in the community, especially those who are unvaccinated, are getting COVID.
Yeah, and I might have said this stat the last time I was here, but during like the Omicron surge, they were saying that those who were boosted were 21 times less likely to die from COVID compared to those who are unvaccinated, and 7 times less likely to be hospitalized. So those are really great big numbers. Those are powerful numbers to really think about when you're considering whether or not to get boosted.
Yes, thank you all for that. So our next question is more about you all's like hesitation and experience with the vaccine and the booster shot, and if you had any like hesitation or if you had questions yourself, or like what research or information did you go look for that you had to know before you went and got the vaccine. Because I know I talked to like different healthcare professionals, and my doctor specifically, she was like, well, I did the research on it. I did the information. I read up on it. She told me like all about the vaccine before I actually got it. Even though I already knew about it and I knew I wanted to get it, she was still like, okay, like this is the information that I got, and I'm just letting you know, like this is what I had, and because I'm your doctor, I want you to know. So like she walked me through all through it, and it made me a lot more comfortable with getting it, even though I knew that the information that I had was correct and that I wasn't gonna be like turned into a zombie or anything like that. So I was okay with the information that I had, but her reassurance and knowing that she did her own personal research and that she got it and that she did her own research before she got it as well, because she also had some hesitation, kind of reassured me that and reminded me that y'all don't know everything, but y'all try your best to do the research and provide us with the correct information. So if y'all could just share any stories or information that you have about that.
Yeah, I think so. Prior to getting the vaccine, because I worked in healthcare, I got it pretty early on after they had released it. But I think it was in December of 2020 when they were starting to come out with the vaccines. And I was following along with a lot of the FDA approval process. So that was the process the vaccines kind of went through to be, approved for that like emergency use authorization that they initially were approved for. So I had followed along on that whole process about, like who they were, how they were approved, kind of what the efficacy or like how well they work. And because I had followed along on that process, I kind of felt pretty comfortable when they offered the vaccine that, they had done at least a decent enough review and it had enough data that it was at least safe. I think I still had some hesitation on how well it worked because, there wasn't like a long period of data on, how well it worked or how well it was going to protect you. But I at least knew that it was safe and it wasn't going to cause a lot of long-term effects. So that made me feel really comfortable getting the vaccine. And we're still learning about how effective it is for the long term. Like, we know that it decreases over time. So we're still having to get boosters or recommending boosters. And so that's information that I still try to keep up to date on is, how soon I would need to get a booster and sort of what the recommendations are and, how needed is the booster? Is it something that is going to really protect me given I'm a relatively healthy kind of young person versus if I were someone like my parents who are like older and less healthy. And I also, read up on those things for them because they want to know, should they get the vaccine and should they get the boosters? I have a lot of patients who are, hesitant or worried about getting the vaccine because they want to kind of know exactly like how it's going to affect them. And so a lot of the resources that I give them are things that have come out from, the CDC, because I think that's a really good place for information about the vaccine and have a conversation about them, about what their hesitations are. Is it, the injection site pain? Is it they're going to feel a little bit sick afterwards? Is it the long-term effects? And try to walk through kind of what their concerns are to figure out what's best for them.
And then for me, I think and I do a lot with vaccines, I teach vaccines to my pharmacy students, and so I knew a lot about the processes and I was also following along. But the thing I wasn't as familiar with was about the emergency use authorization and how that can help speed up the process for when it gets approved. So that was kind of where some of my hesitancy came from initially. So I really had to read up about it. And, just like Dr. Silva said, I went to the CDC website and read about from there. There was a nice infographics with, links and resources to kind of help you understand a little bit more. So that really helped me. And I think I talked about it the last time I was here about my concerns because I was breastfeeding at the time and whether or not I felt safe getting the vaccine and then potentially passing it along to my baby. And a lot of that was, thinking about what I know about the science behind how vaccines are working in general, and doing some more research about what's available, if there was anything available regarding vaccines, COVID vaccines, and breastfeeding. So I think after doing my own research and feeling a little bit better, I felt like it was at least safe. It may not actually help the baby, which nowadays it actually shows that it does help the baby, and kind of passing along those antibodies. But at the time, I felt like it was safe enough that hopefully it will benefit both of us by doing that. In terms of patients, a big thing that I've been getting in terms of their hesitancy is just that there's just been so many changes, and the changes makes them wonder whether or not everything was true to begin with, or what is true now. And I think what I try to remind them is that we're learning about COVID over time. We're learning about the vaccines over time because we're learning about COVID. And it's a good thing that there are changes when we learn new things, right? We don't want to stay stagnant. We don't want to stay still. We don't want to hide things from you. So it's better that we continue to make changes when we learn about them. So that's what I kind of try to tell my patients as well.
Sid, I don't know if you're able to talk, but if you are, then it's time for the next question. If not, then I can ask the next question because I know you're still getting settled. All right, I'm gonna take that as a
Yes, I can talk. I got
All
it.
right, all right.
So, so something that has definitely caught my attention and my concern is the fact that they have changed the quarantine date from 14 days to my school saying 5 days now. Why do you think that is? I know at first you was taking quarantine very seriously, and people even extended their own quarantine by personal choice. So why do you think people? Well, the CDC, the government is saying quarantine isn't required to be that long anymore.
Yeah, so I think there's a lot of reasons for that change. And part of that change is as we learn more about COVID and at what periods people are spreading the most virus, we kind of are able to better direct how long people should quarantine for. So initially when COVID first came out and we didn't know a ton about it, we didn't know how long people were infectious for. So that means they could, or contagious for, so how long they could spread the virus to other people. It was a lot harder to recommend exactly how long that you could quarantine for. Now that we've learned more about the virus and how long you are infectious or contagious for, they've been able to say, it's probably reasonable to reduce that amount of quarantine. It's also still recommended that with the reduced amount of quarantine, you're still wearing a mask because that helps prevent the spread to others. So if you if you do have COVID and you come out of quarantine more at 5 days or that 7 days, that means you're still wearing a mask to make sure that if you do have some of the virus left over in your nose or in your mouth, that you're not spreading that. So although the quarantine has decreased, you should still continue to wear a mask after you've had COVID to kind of decrease that chance of spreading it to others.
I don't have anything to add.
But yeah, it's just as we learn more about that, they're able to do it. I think that the other thing I would say, I think as a healthcare provider, I think when the CDC changed those recommendations, I was a little bit more hesitant. I was like, oh, that sounds like it's going a little too fast. And I think it's, I think it is also a mixture of things. It's as we learn more about the virus and how people are contagious, but also like people are trying to seek a little bit of that normalcy, and being out of work for 14 days is quite a lot, especially if we don't think that you're actually actively spreading the virus. And so it allows, we have a little bit more information on how long you're actively spreading the virus after you start symptoms or after you test positive for COVID.
I will say that it's an average, right? So it's kind of like a range, which is kind of where the recommendations come from. But, just keeping in mind that it's a choice to end isolation early and then wear your mask and be outside. So if you guys don't feel comfortable, then definitely stay home.
Okay, so I guess a follow-up question to that.
Wait, I was ready to say, I got a follow-up question real quick.
All right, go ahead, Sid.
I just wanted to know y'all's experience after getting the vaccine. Like, I know that everybody had their own different situations, and some people said like their arm swelled up, or they had like a migraine and they were like weak for a day or two. I just wanted to know, like, what was your personal experience after getting the vaccine? And if you had a bad experience, did that change your opinion on the vaccine?
Yeah. So I got my vaccine probably the week that I was able to get it through the university. And right afterwards, it was fine until maybe like 6 or 8 hours in. It was like almost bedtime, I think, at the time. And my arm just started hurting so bad. Like I was thinking to myself, wow, this is like the worst like arm pain I've ever had from getting vaccines in my entire life. But I was like, I'm just going to keep on thinking that it's helping protect me. And I went to bed and I had kind of like flu-like symptoms. I had to take some Tylenol because I felt like I was having chills. And my second dose was actually even worse than my first. I had even more chills and more flu-like symptoms. And I ended up, because I knew how I felt from the first one, I had scheduled on a day that I was going to be able to stay home. And thank goodness I did. But so I was thinking when I was going through that wow, like, could I really do this every year? And I really was thinking that in the middle of the night when I was getting chills and I was like taking a lot of Tylenol and stuff trying to help me feel better. But the weird thing about the vaccine is that it goes away like just as fast as it came, like the symptoms that I had, like when you get the real flu, like it kind of creeps on in and then it takes forever to go away. But this one was like, I woke up and it was like all better. Like I was full of energy again. So I think that helped me kind of like change my mindset a little bit, but I'm not going to lie that I definitely felt pretty bad when I had my vaccine. But I will say, just so you guys know, I had gotten COVID before I got the vaccine. So my reaction is probably a little bit different from some people.
Yeah. I would say I didn't have as bad as a reaction as Deanna. So I got the vaccine, and certainly after like at the end of the day, my arm hurt. I felt like a little more tired. I probably went to bed at like 8 p.m. that day and felt a little bit feverish, but I woke up the next day feeling perfectly fine. And that was the same for my second vaccine. When I got the booster vaccine, it was a little different. I got the booster and the flu vaccine on the same day. So it was like a 1-2 hit in both of my arms. So that the next day, both of my arms were sore. It was hard to lift them. And I usually have a pretty more of a reaction to the flu vaccine. I dread my flu vaccine every single year. And so it could have been a little bit more of the flu vaccine, but my arms definitely hurt. It laid me out for kind of the next day. But people have a very big spectrum. I know like my partner, he also works in healthcare, so he had to get the vaccines. And he was certainly hesitant to get his second one because after his first one, he got a fever. He felt pretty terrible and probably lasted for about like 24 hours. And then he started to feel better. But he had a whole day of just feeling like feverish and tired and his arm hurt. And then like Deanna said, it just kind of went away after that 24 hours. But he's made it through with his second and third dose now. Every time he's like, okay, I'm going to like go home, take some ibuprofen, take some Tylenol, and just plan to like watch a movie for the rest of that night. And I see with patients as well, some of them are like, I got it and it wasn't even anything. Did it work at all? Because all these people are saying that like their arm hurt. And I've had other patients that are more in that spectrum of they don't feel they feel kind of those mild flu-like symptoms for, 1 to 2 days after they get their vaccine.
So my follow-up question, I was like slowly forgetting it, and I'm like slowly forgetting it now, but I think I'm remembering. So as y'all find out more about COVID and like what it is. 'Cause I know y'all talked a lot about like y'all learning more about like how long it stays in your system, how long you're like no longer going to be contagious to other people, and that's why like the quarantine days were shortened because y'all are starting to learn more. So as we learn more about COVID and start to understand it more, do you think that we could like start returning back to normal and like we could drop the mask completely, or will it kind of be like a always, not always, but like a on the fence thing for like a long time, even though after we've learned so much about COVID, will masks just become like a normal thing now to like infectious viruses? 'Cause I never like wore a mask if somebody had the flu or anything like that. So now will this kind of be like the new normal for us to use masks as a new form of protection against viruses and different things that we come across?
I guess I'll start to say, I don't know if everything is 100% going to go back to normal. I mean, not only with COVID, but we've just seen a lot of changes in kind of the world in the last 2 years. In regards to masks, like I personally think that I'll probably continue to wear a mask when I'm in, a public place with a lot of people, because I really enjoyed not getting sick the last 2 years. So I used to get, like I work with adults, I work with kids. Kids will always just cough in your face in the middle of a visit. And so I used to get like the flu every year, colds every year, be like super sniffly from like mostly from getting stuff from my patients, or like every time I flew, I flew to take a trip, I would end up with like a little cough or cold or something. And now I haven't had that in the last 2 years. And I've like worried about getting a cold because I'm like, oh, I don't know. I don't remember what it's like to get like a normal cold. And so me personally, I know I'm going on a trip like later this week, and some of the they're recommending some of the places like don't have mask recommendations, and I'm probably going to not wear a mask when I'm eating, or like of course, or when I'm out with friends. But if I'm like in the plane, I'm probably still going to wear a mask because I don't want to get sick during my vacation.
You definitely attest that I now remember what colds are like, and it's terrible. Like, was I really like getting colds all the time? Because I feel like I'm such a baby right now with the colds that we've been getting in my house. I feel like, and I definitely agree with Dr. Silva, I think part of it is that we'll define a new normal. It won't look like what we called normal, but it's kind of like growing up, right? You kind of adjust to, as you grow up, that becomes your new normal. And hopefully that we'll grow up from COVID and we'll kind of see what this new normal is, but we'll get used to it, whatever that might look like. But I agree with Dr. Silva. I don't think that masks will completely go away. I think that it's kind of changed how we work in healthcare and for everyone else in the world.
I know personally me, I like the mask. I feel like it's just like a nice extra layer of protection, and I don't know, I just love it. Sometimes I take it off, of course, like when I'm around friends and things like that, and of course like when I'm out eating. But sometimes I forget it's even on, so it feels like it's like really a part of me sometimes. Like I'll just walk around the house for like 20 extra minutes when I come in from off the bus from school. My mother's like, you still got your mask on, and I'll be like, oh, I didn't even realize. So sometimes it just feels like it's a part of me. But I can definitely relate to what Dr. Silva said about the kids that just cough and sneeze right in your face. I have two nephews and a niece, and before they knew how to like cover their mouth when they're sneezing or coughing, it was just like he was holding them, and it was just like boom, right there. So it just made me think of like so many instances that when that has happened. But y'all, we're coming to the end of our session. Hopefully, y'all can join us for the next one where we'll go into the next one, which will be our last one, unfortunately. But I'm pretty sure that Dr. Silva and Dr. Tran will leave open an open line of communication if y'all have any more questions. But I think like we're answering like pretty much everything. But the next session will just be like another information session. We might have some slides, but it'll just be like another quick run through to leave y'all with about the booster, about the COVID, about the vaccine, just to give y'all another like in-depth little information session before this be the last of our COVID booster sessions. But I'm pretty sure y'all will see Dr. Tran and Dr. Silva again on many of these sessions that we have with Heart Smiles or Higher or whatever it is. But we're just gonna go around and give out jewels. So if y'all could just share like your favorite part of like the session or what you want to leave with the audience, we'll just go around. I'll go first, and then Dr. Tran, you can go next. So I don't know what I'm gonna say to y'all. I guess I would say is to be careful and protect yourselves and others by wearing your mask and practicing social distancing still, and also being honest about your COVID results and who you're around and making sure that you're doing like your own form of contract tracing. So making sure if you do test positive that you let other people know. If you were around somebody who did test positive, that you let the people that you're around know as well. And just kind of keeping that open line of communication and being transparent with the people that you're around, and making sure that you're not just letting anybody walk around and they possibly could be sick or passing around COVID.
So my jewel is that to think that changes are good. We don't want to stay still. You know, we're going to adapt with changes. We're strong. You're strong. So empower yourself. Adapt to change. Look up things so you feel more comfortable. Get the information you need, and kind of work with the change. Go with the change. Ride with it.
Okay, I think my jewel for today. Oh, sorry, you can go first, Sydney.
I was just gonna say, my jewel for the day is to definitely don't believe everything you hear or everything you see. To do your own research and just consult with experts such as Dr. Tran and Dr. Silva before making your own opinion about something as important as COVID.
And my jewel kind of goes on along with that of don't be afraid to ask questions. I think a lot of people are, hesitant to ask their doctors or, when they see them or other people about, the COVID vaccine and kind of the safety of it or getting COVID or some of the things that they hear on the media, they just kind of take it at face value. And definitely don't be afraid to ask questions, to do some research to kind of figure out what is best for you.
All right, y'all. So that concludes our session for tonight. Thank you, Dr. Tran and Dr. Silva, for joining us. We will see y'all in the next session. And hopefully everybody in the audience will see y'all at the next session as well. Thank you so much for you all spending your time with us and filling us in with all this information, engaging with these wonderful conversations. I never knew COVID could be so much fun. And so I really do enjoy these sessions with you all. And I really do appreciate y'all spending your time with us. Just telling us all this information and what you do, being so vulnerable and sharing your experiences. So we really do appreciate it. But this is the end of our session, and we will see y'all at the next one. Thank you.